Welcome! Today, we're diving into the topic of benign prostatic hyperplasia, or BPH. This condition is commonly seen in older men and can significantly impact quality of life. In this video, we'll explore what BPH is, why it happens, and how doctors diagnose it. Whether you're seeking information for yourself or a loved one, understanding BPH is the first step toward effective management. Let's start by defining what BPH actually means and why it's important to recognize its symptoms early. Benign prostatic hyperplasia, or BPH, is a non-cancerous enlargement of the prostate gland. The prostate is a small gland located below the bladder in men, and it surrounds the urethra, which is the tube that carries urine out of the body. As men age, the prostate can gradually grow larger. This growth is considered benign, meaning it's not due to cancer. However, the enlarged prostate can press against the urethra, leading to urinary symptoms. Understanding this basic definition helps set the stage for recognizing the signs and seeking timely diagnosis. To better understand BPH, it's helpful to know where the prostate gland is located. The prostate sits just below the bladder and wraps around the upper part of the urethra. Its main function is to produce fluid that nourishes and transports sperm. As the prostate enlarges with age, it can squeeze the urethra, making it harder for urine to pass. This anatomical relationship explains why BPH leads to urinary symptoms and why it's a common concern for aging men. BPH is most common in men over the age of 50. As men get older, the likelihood of developing BPH increases. While the exact cause isn't fully understood, hormonal changes related to aging are believed to play a significant role. Genetics and lifestyle factors may also contribute. It's important to note that BPH is not cancer, but it can cause bothersome symptoms that affect daily life. Recognizing who is at risk helps with early detection and management. The symptoms of BPH are mainly related to urination. Men may notice a weak urine stream, difficulty starting urination, frequent urination, especially at night, and a feeling that the bladder isn't completely empty. Some may also experience urgency or dribbling at the end of urination. These symptoms can range from mild to severe and often worsen over time. Recognizing these signs is crucial for seeking medical advice and getting a proper diagnosis. The reason BPH causes urinary symptoms is due to the enlarged prostate pressing against the urethra. This pressure narrows the passage for urine, making it harder to urinate. Over time, the bladder muscle may also become overworked, leading to more frequent urges to urinate. Understanding this mechanism helps explain why even a non-cancerous growth can have a significant impact on daily life. If you notice urinary symptoms, the first step is to visit a healthcare provider. During the initial visit, the doctor will ask about your symptoms, medical history, and any medications you're taking. This conversation helps the doctor understand the severity of your symptoms and rule out other possible causes. Open communication is key to an accurate diagnosis and effective treatment plan. Doctors often use standardized questionnaires to assess the severity of BPH symptoms. One common tool is the International Prostate Symptom Score, or IPSS. This questionnaire asks about the frequency and severity of urinary symptoms, such as urgency, weak stream, and nighttime urination. The answers help the doctor determine how much BPH is affecting your quality of life and guide treatment decisions. A physical examination is an important part of diagnosing BPH. The doctor may perform a digital rectal exam, or DRE, to feel the size and shape of the prostate gland. This exam involves gently inserting a gloved, lubricated finger into the rectum to check for enlargement or irregularities. While it may be uncomfortable, it provides valuable information about the prostate's condition. Urine tests are commonly used to rule out other causes of urinary symptoms, such as infections or blood in the urine. A simple urine sample can provide important clues and help the doctor determine if further testing is needed. These tests are quick, non-invasive, and play a key role in the diagnostic process for BPH. Blood tests may be ordered to check kidney function and measure prostate-specific antigen, or PSA. PSA is a protein produced by the prostate, and elevated levels can indicate prostate problems, including BPH, or, less commonly, prostate cancer. Blood tests help doctors get a clearer picture of your overall health and rule out other conditions. The PSA test measures the level of prostate-specific antigen in the blood. While higher PSA levels can be seen in BPH, they can also occur with prostate cancer or infections. Therefore, the PSA test is just one piece of the puzzle. Doctors interpret PSA results alongside other findings to make an accurate diagnosis and decide on the best course of action. A urinary flow test, or uroflowmetry, measures how quickly urine flows out of the bladder. During this test, you urinate into a special device that records the speed and volume of your urine stream. Reduced flow rates can indicate obstruction from an enlarged prostate. This test helps doctors assess the severity of blockage and guides treatment planning. Another useful test is the post-void residual measurement. This test checks how much urine remains in the bladder after you urinate. It's usually done with an ultrasound or a catheter. High residual volumes suggest that the bladder isn't emptying properly, which is a common issue in BPH. This information helps doctors tailor treatment to your specific needs. Imaging tests, such as ultrasound or MRI, may be used to visualize the prostate and surrounding organs. These tests provide detailed images that help doctors assess the size of the prostate and rule out other conditions, such as tumors or bladder stones. Imaging is especially helpful if the diagnosis is unclear or if surgery is being considered. In some cases, a cystoscopy may be performed. This procedure involves inserting a thin, flexible tube with a camera into the urethra to directly view the bladder and prostate. Cystoscopy helps doctors identify blockages, strictures, or other abnormalities that may be causing symptoms. While not always necessary, it provides valuable information in complex cases. Urodynamic studies are specialized tests that measure how well the bladder and urethra store and release urine. These tests can help distinguish BPH from other urinary problems, such as overactive bladder or nerve-related issues. Urodynamic studies are typically reserved for complicated cases or when initial treatments haven't worked. It's important to distinguish BPH from other conditions that can cause similar symptoms. These include urinary tract infections, bladder stones, prostate cancer, and neurological disorders. Doctors use a combination of history, physical exam, and tests to rule out these other causes and confirm a diagnosis of BPH. While BPH and prostate cancer can both cause an enlarged prostate and similar urinary symptoms, they are very different conditions. BPH is benign and not life-threatening, while prostate cancer can be serious and requires different treatment. Tests like PSA, physical exam, and imaging help doctors tell the difference and ensure the right diagnosis. If you experience urinary symptoms that interfere with your daily life, it's important to see a healthcare provider. Early evaluation can help identify BPH or other conditions and prevent complications. Don't ignore symptoms like difficulty urinating, blood in urine, or pain, as these may signal more serious issues. If left untreated, BPH can lead to complications such as urinary retention, bladder stones, recurrent urinary tract infections, and even kidney damage. That's why timely diagnosis and management are so important. Addressing symptoms early can help prevent these serious outcomes and improve quality of life. To summarize, diagnosing BPH involves a combination of symptom assessment, physical examination, urine and blood tests, and sometimes imaging or specialized studies. Each step provides valuable information that helps doctors confirm the diagnosis and rule out other conditions. A thorough evaluation ensures the best possible care and treatment plan. A urologist is a doctor who specializes in urinary tract and male reproductive health. If your symptoms are severe or if initial treatments don't help, your primary care doctor may refer you to a urologist. These specialists have advanced training and can offer a wider range of diagnostic tests and treatment options for BPH. Open communication with your healthcare provider is essential. Be honest about your symptoms, how they affect your life, and any concerns you have. This information helps your doctor make an accurate diagnosis and recommend the most appropriate treatment. Remember, no symptom is too small to mention. Keeping a diary of your urinary symptoms can be helpful. Note when symptoms occur, their severity, and any patterns you notice. This record can provide valuable insights for your doctor and help track changes over time. It's a simple step that can make a big difference in your care. Certain lifestyle factors can influence BPH symptoms. For example, drinking large amounts of fluids in the evening, consuming caffeine or alcohol, and some medications can worsen urinary symptoms. Discussing your habits with your doctor can help identify triggers and improve symptom management. Family history can play a role in the risk of developing BPH. If your father or brothers have had prostate problems, you may be at higher risk. Sharing this information with your doctor can help guide screening and early intervention strategies. Some medications can worsen BPH symptoms, such as decongestants or antihistamines. These drugs can tighten the muscles around the urethra, making urination more difficult. Always inform your doctor about all medications and supplements you're taking to avoid potential complications. Routine screening for BPH isn't recommended for all men, but those with symptoms or risk factors should be evaluated. Screening may include questionnaires, physical exams, and PSA testing. Early detection can help prevent complications and improve outcomes. Understanding BPH empowers patients to make informed decisions about their health. Educational resources, support groups, and discussions with healthcare providers can help you learn more about the condition and available treatments. Knowledge is a powerful tool in managing BPH. Imaging techniques like ultrasound provide a non-invasive way to assess the size and structure of the prostate. These images help doctors confirm BPH and plan treatment, especially if surgery is being considered. Imaging is safe, painless, and widely available. After all tests are completed, your doctor will review the results with you. Understanding what each test means and how it relates to your symptoms is important. Don't hesitate to ask questions or request clarification. Clear communication ensures you're fully informed about your diagnosis and next steps. Shared decision-making means working together with your doctor to choose the best diagnostic and treatment options. Your preferences, lifestyle, and goals are important factors in this process. By staying informed and involved, you can help ensure the best possible outcome. BPH is a chronic condition that often requires ongoing monitoring. Regular checkups and repeat tests help track changes in symptoms and prostate size. Early detection of any worsening can lead to timely adjustments in treatment and prevent complications. Early diagnosis of BPH can make a significant difference in outcomes. Prompt evaluation allows for timely treatment, reduces the risk of complications, and improves quality of life. If you or someone you know is experiencing symptoms, don't delay seeking medical advice. Many organizations offer support and information for men with BPH. Support groups, educational websites, and patient advocacy organizations can provide valuable resources. Connecting with others who have similar experiences can be reassuring and empowering. Primary care doctors play a key role in the initial evaluation and ongoing management of BPH. They can perform basic diagnostic tests, monitor symptoms, and refer to specialists when needed. Building a strong relationship with your primary care provider ensures continuity of care. Several risk factors increase the likelihood of developing BPH, including age, family history, obesity, and certain medical conditions like diabetes and heart disease. Knowing your risk factors can help you and your doctor decide when to start screening and how to manage symptoms. BPH can have a significant impact on daily activities, sleep, and overall well-being. Addressing symptoms and seeking timely diagnosis can help restore quality of life. Remember, effective treatments are available, and you don't have to live with bothersome symptoms. Let's recap the key points. BPH is a common, non-cancerous enlargement of the prostate that affects many men as they age. Symptoms are mainly urinary and can impact quality of life. Diagnosis involves a combination of history, physical exam, lab tests, and sometimes imaging. Early detection and open communication with your doctor are essential for effective management. If you're experiencing symptoms of BPH, know that you're not alone. Many men face similar challenges, and help is available. Don't hesitate to reach out to your healthcare provider for evaluation and support. Taking the first step can lead to better health and improved quality of life. Advances in medical research continue to improve our understanding and management of BPH. New diagnostic tools and treatments are being developed, offering hope for even better outcomes in the future. Staying informed and proactive is the best way to manage your health. For more information about BPH, consult reputable sources such as the American Urological Association, National Institutes of Health, or your local healthcare provider. These organizations offer up-to-date information, educational materials, and support for patients and families. In summary, benign prostatic hyperplasia is a common and manageable condition. Early recognition, thorough diagnosis, and open communication with your healthcare team are the keys to effective management. Remember, you have options and support every step of the way. Thank you for joining us on this journey to understand benign prostatic hyperplasia and its diagnosis. We hope this information has been helpful and empowering. Stay informed, stay proactive, and take charge of your health. Until next time, take care.